Good day and welcome to the first edition of Tobacco and You, a program designed to educate you on the dangers of tobacco consumption and tobacco substance consumption. And we'll also be educating you on how you can abstain from tobacco and the substance of tobacco. We'll be talking about governments and government institutions and how they contribute in eradicating tobacco from the system. Like I said, it's a conversation program, so we would like to hear your views too, and you can send us your questions, tobacco-related questions, on our social media platforms. Facebook, our handle is Tobacco Control Nigeria, and on Twitter is Tobacco CTRL, and on Instagram it's Tobacco Control. So just send your questions and we'll be there to answer every of your questions. It's related to tobacco. Thank you. Today I have with me a medical practitioner, someone who is very, very well informed on the topic of tobacco, and today she will be doing justice on the topic of the day. Her name is Mrs. Juma Kudirat. You're welcome to the show, ma.
Thank you, ma.
Yes.
Thank you.
Okay. So, madam, please, would like to ask, how is tobacco injurious to our health?
Yes, tobacco is injurious to the health. Firstly, I'll talk about what's a tobacco. Tobacco is a green leafy plant that is grown in a warm climate, and it is basically dried, picked, and it is done into different forms. So it could be smoke in form of cigarettes, cigar or pipe. It could also be chew in form of that's what we call a smokeless tobacco, or is sniffed through the nose. It has some active ingredients that make it dangerous to our health. Firstly, we have nicotine, that is the addictive substances in tobacco. We also have carbon monoxide, we have arsenic, we have coal tar, and some other ingredients, so that make it injurious to our health. So firstly, I'll be talking about the cardiovascular effect of tobacco. It has some effect like heart attack, but before we get to the heart attack effect, there are something like the person that smokes could have peripheral arterial diseases. Then it leads to heart attack along the line. Then after which, yes, peripheral arterial diseases.
Because to a layman like me, I don't really understand what you mean by
yes. What actually happens is like there is a lining of the artery. It's actually constricts. When there is a thinning, the blood vessel, when someone smokes, realize that the blood vessel become thickening, and when it now happens, there is a constriction. The way the blood will pass through it is constricted, and it continues to narrowing, and during that narrowing of the blood vessel is what leads to peripheral arterial diseases. I hope you get that. Okay. So from there, when it happens like that, it could actually lead to blood clots. When blood clot occur, that is the risk factors of heart attack coming in, or we call it heart disease or heart attack. So aside the heart disease, okay, there is also in cardiovascular system, okay, there is also what we call in cardiovascular system, there is also what we call myocardial infarction, and other heart disease can also occur. So let me move to the sex and the reproductive system. Okay. We realize that men and women, if you're a smoker, men and women, their sexual desire is usually affected. In a man, we realize that the man's sexual desire will be reduced like it will not get satisfied when it has sex. The way it's because of there is a decrease in the hormone level. And in a woman, we realize that if you're a smoker and you're a woman, you get dissatisfaction in sex. You will realize that okay, the man will still need to apply more energy before the man can satisfy you, because there is a reduction in the orgasm and the lubrication level is reduced, and she won't get satisfaction unless she stops smoking. So that's that about the sexual system.
Okay, so you've talked about the cardiovascular and then the sexual system.
So I will move to the integumentary system now. That's the skin, the nail, the toe, the nails and the toe, basically. So we realize that recent research has shown that actually shown that apart from there is a changes in the skin, like that's when we talk about wrinkling on the skin for someone that smoked. And aside that, recent research shows that the person have a risk of developing cancer. We call it a squamous cells carcinoma. That's one of the cancer that can occur in the skin. And aside that, at the toe, there's what we call a tinea species of a tinea species. That's a fungal infection of the nail. It also occurs in a person that smokes. That one is a recent research too. And aside that, there is an old research that shows that if someone smokes, you may likely have something like hair loss, hair loss, balding, and a graying. The hair will change and some other things can occur. That's an older research as regard integumentary system. So we move to digestive system now. So research has also shown us that when you smoke, you're likely to have the risks of either mouth, the larynx, the throats, and the esophagus cancer. Okay. And aside that, we also there is also a research that actually shows that if you're using a smokeless tobacco, for instance, a smokeless tobacco is like a tobacco without a smoke, as in you don't inhale the smoke directly. So you may actually the risk there is a risk of having mouth cancer. Okay, mouth ulcer cancer.
If you smoke, you can also be affected by.
Yeah. That's what we call a second-hand smoke. When you stand or sit near someone that smoke, when you stand or sit near someone that smoke, like you tend to inhale the exhaled end of the burning end of the cigarettes, or the smokes that a smoker exhale directly. So when you inhale that, you second-hand smoke. So we call them second-hand smoke. And some of the effects that someone that smokes has, the person that is second-hand smoke does have the same side effect, like heart attack. You still have the same effect, bronchitis. You still have emphysema. And that is the more reason why we're counseling our children. Like if you have a parent that smokes, you have to be very careful. You don't stay around that parent at that moment, because you're still most likely to have the same effect. Like you can have ear infection, you can also have asthma, you can be having whistling, coughing, and some other disease similar to what the same thing that the person that smokes will have.
Okay, you just said that you counsel, young people, especially the ones who have parents who smoke and all that. So what do you do for these young people? Like when they come to you and they complain about, their parents being smokers and all that, how do you protect them from this deadly epidemic?
Yeah, that is the reason why we are trying as much as possible to synthesize and disseminate the information to the youth out there, those ones in secondary school, boarding school, like, okay, if you have a parents that do this, you can actually, some of them, because we realize that it actually happened to a low-income earner and those people that are not educated. But if you can train your child to go to school and is educated about all this, he can go back home and explain to the parent, like, okay, my parent, this is this, and this is the active ingredient that a cigarette contain. It has this, that some quota that they use in road is there. Carbon. Yes, we done that recently. Yeah, yes, we done that recently at Otta. Ikomode Grammar School recently, just to enlighten the youth out there, because the epidemiology research has shown that they really after a age of 18 to 24 are more likely to become a current smoker. So that's the reason why we're targeting the youth out there to give them the necessary information they need to know about tobacco.
Okay. Yeah, thank you very much. Now, when we're talking about tobacco, like we talk about tobacco and then we talk about the tobacco substance, which cigarette is part of it. Now, cigarette is one of the very popular one that a lot of people know about.
Yeah.
Now, but the thing is that aside from cigarettes, there are still other, other substance of tobacco, other things that people need to know aside from smoking. So, can you really tell us, this other substance that you can find tobacco in?
Okay, thank you. There is also carbon monoxide, as I have said. This carbon monoxide normally is oxygen that's supposed to combine with hemoglobin in the blood to form oxyhemoglobin. But we now realize that when carbon monoxide make it harder for the oxygen to pass through the blood, because the carbon wants to replace the oxygen to form carboxyhemoglobin. So all of those things, this carbon monoxide is one of the active ingredients, one of the ingredients that is present in cigarette. We also have arsenic, we also have coal-tar, we have...
these are ingredients that are found in...
Yes.
They are tobacco-related ingredients. That
yes. We have over 4,000.
What I'm saying is tobacco in other substance aside from cigarettes.
Okay.
Like aside from smoking cigarettes, you talked about chewing.
Yes.
So if you can mention, because I'm sure our viewers out there will really want to know other things, other things that you can do, like the chewing aspect, the sniffing aspect of it. I'm just saying the ones that I know. I'm sure you know a lot because you're a professional in this field.
Yeah.
So if you can just tell our viewers so they too can get awareness on this substance that they should avoid.
Thank you. There is also what we call cretis and there are so many other ones, like okay, that one is cigar and the pipe. They are in form of smoke, as in it's also like a smoked tobacco. The crate is also a smoked tobacco, but the chewing tobacco and the one you sniff directly through the nose, I just know them as you sniff it directly into through the nose.
And they are as harmful as smoking of cigarettes.
Yes.
Thank you very much. Now, viewers, you have heard from our medical professional here. She has actually she has actually told us a lot about tobacco and how it affects our health. I mean, it's really scary hearing her say all these things about tobacco. So we really want to hear from you. We want you to send your questions through our social media platforms, and our guest here will be willing to answer every one of your questions. Thank you. Now we have a question already from a viewer. This is from Twitter, and our Twitter accounts. We have a question here, and this is Nikki asking on Twitter. She said, how does tobacco affect newborn babies? She's asking, how does tobacco affect newborn babies?
Yeah, thank you. The tobacco actually affects newborn baby in the sense that you can, the pregnant woman can give birth to a newborn baby that has fetal injury. You could have a prematured, a low birth weight, for instance. And there's what we call SIDS, sudden infant death syndrome. You just realize that the baby just give up without no cause. Did you understand? That's what we call SIDS, sudden infant death syndrome. The baby will just what happened? Suddenly, what happened to this baby?
So how do children actually, get this? Because they are newborn babies, they obviously don't smoke.
Yeah. The pregnant woman, before you give birth, you should have been enlightened about, okay, you're smoking and you're pregnant.
It's pregnant women when they are pregnant.
Yes,
when they take tobacco,
yes.
baby in them.
Yes, so you should be aware of the side effect. That, okay, the baby that is coming might have a fetal injury, might has a low birth weight. You do understand? Might have even the SIDS that I mentioned. So you should be very careful and you monitor the baby very well in order not to fall into that victim.
Okay. All right, before we get our other questions from our social media platform, I would like to ask this question. There is this, there are so many awareness, there are so many campaigns going on tobacco and everything, with the risk we go about and we see terrible pictures on how tobacco affects people and all that. But despite all this campaign, there are still people that are adamant that have decided not to leave tobacco. They still smoke. So what would you say about this?
Yeah, the reason is that, research has shown that some of those things takes like 20 years to manifest. Because I met someone recently, I said, I'm counseling the person. I said, my daddy smokes for years and he's still healthy.
Because he's healthy, he smokes, and you said you're not quitting. So I advised the guy immediately. I said, no, please stay with that. It's not about now, it's about future. So that you don't spend all your money on trying to, cancer is very, 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 you keep spending money, you can only manage it, you can't treat it. So so that's the reason I was telling the person, no. So try and please. And research has already shown that 35 years and older are already quitting from here, seriously, from the tobacco. So what are we talking about? Why is your daddy of 70 years not living it? So I really counsel the person. I know in the next, when I'm meeting the guy again, I know they would have done something.
All right, thank you. Let's take some other questions from our viewers. Now we have another one from Twitter, and it's Folewa from Twitter, and she's saying, is sitting near a smoker deadly? We've actually talked about that. Yes. I think, Shalewa, wherever you are, sitting close to someone smoking is really deadly. And our guest here has already talked a lot about that. So you should stay away from people who smoke, because you can be affected as well and you'll be killing yourself gradually without a enhanced smoke. Take before it affects the body. How long does it take for? Before it affects the body?
Yes, that's what I'm saying. Depends on each person's body physiology. Like you may sit beside that person, immediately you start coughing. So that's one of the signs we're saying. So immediately,
get it immediately.
Yes. When you sit, you kind of person that smokes before, you sat down beside someone that smokes, and immediately you inhale it, you start coughing immediately. Did you understand? It depends, and some can actually it depends on each person's body physiology. Immediately some will start coughing and showing the sign, and some will take the next time the person is sitting down, it's good. Did you understand? So it depends on individual body physiology. But what we are saying in essence is that you still at the end of the day have the same effect with someone that smokes. Please, we are employing everyone not to sit or stand near someone that smokes. That's just the
Alright, thank you very much. Thank you very much. It's been wonderful having you here on our show. This is our maiden edition, and of course we will still invite you to come back, to come back in other previous subsequent show. Thank you very much for coming. Thank you. Yes. So viewers, you have heard all about tobacco today. Not everything, but you've heard a lot about tobacco, and I'm sure you have learned. It's been really, really interesting. I've actually learned a lot that I did not know about. She talked about, how it affects the skin, how it affects, your blood system and all that. I mean, these are some things here are actually new to me, and I'm sure they are new to you. There are things that you're just learning for the first time too. Okay, so thank you so much for those of you who sent your questions. Thank you so much for sending your questions, and we'd like you to still be following us on our social media platforms.
send your questions, and we'll be willing to answer you. You can send us, we can still answer some of these your questions after now. So thank you so much for having us here on the show. I have had a great time, and I'm sure you too have had a great time. So we would like to see you again on this station in 2 weeks' time. Okay, thank you so much. My name is Ume Oswoka, and it is bye for now.